I'm looking for. My first question is, what is...
My name is Dr. Dalal Akoury.
And could you spell your name for me?
Yes, Akoury is my last name.
Is this your business, and what do you do at this business?
It is my business, but it's my passion. I'm doing this because I want to make people feel great from the inside out. And just that's what I want to do. I want people to feel strong, powerful, happy, joyful, and just tap into their inner power.
And what kind of procedures do y'all have here?
Oh, you have no idea. We have so many. I do integrative medicine, which means I use any tool in any toolbox that I've really trained in to manipulate it to create a customized plan for each one of my patients so that they can feel strong, they feel powerful, they feel happy. They just be optimized and just live high peak performance.
And tell me, what is this vampire facelift, and how did y'all end up doing it here, and just kind of what is it?
Well, I think vampire is a great way to market something because it's just a very strong, powerful word. Really, vampire facelift is like any other way of using cell therapy to treat the face. What is cell therapy? Is using stem cells or using growth factors that we all have. That's why we regenerate. Like you cut your finger, you have enough stem cells to regenerate and just you heal. People who have immune deficiencies or have problems, they don't heal fast. Why? Because they don't have good, healthy stem cells. So it really is the vampire facelift really depends on harvesting from your blood something called the buffy coat. Inside that buffy coat, which separates the red from the serum, the red cells from the serum, there's a white coat, and that is called a platelet-rich plasma. That area is where a lot of growth factors are there, and these growth factors help to recruit stem cells to the areas you're doing your lift in. So we have done PRP for many years in the face, in the joints, but recently the word vampire facelift, and I trained in that, it just gives it a different facelift itself. The PRP procedure itself now has a different facelift, which is vampire lift.
And has this been a popular procedure with clients?
Well, it's been very popular, but my patients or my client or my friends who come and get it done, really, I want them to know that the inside out is prettier than the outside in. So what I mean is, the success rate of that procedure really depends on how you take care of your body. If you're eating right, if you're exercising, if you're having the right nutrients in, you're going to have an amazing result of the vampire lift. If I give you a vampire lift and I'm not going to even harvest good growth factors from you if you are eating sugars, so you need to understand that when you are ready for that lift and that beautiful look, you need to have a very powerful inside, a cleanse, a cleaning, so you have healthy growth factors that I can use to inject in different parts of the face in order for me to help you recruit your own stem cells and then give you that beautiful, beautiful look. But we do the vampire lift, but there's other cell therapies we do. We use harvest fat, and that also is really rich on mesenchymal stem cells. So there's many different versions of this.
And this one, I know Kim Kardashian did it,
yes.
So that's what made it popular, or what made it known, I guess, put it on the map. Yeah. So after she posted about doing it, did you get people asking you about it, or?
Yes, more. And also, this has been going on for the last 6 years. And of course, it's like anything else. It gets its power. The main thing is really to know we need to heal from the inside out, and need to know that you have to go to a physician or a surgeon or a plastic surgeon or even a nurse practitioner that have trained in this. There's so many people right now that are trying to, unfortunately, use these things, and they have no training, and that's where the danger is.
And so what is someone, if they are interested in looking to do this, what do they need to look for as far as credentials in order to know they're in safe hands?
Oh, what a wonderful idea. Number one, you want to make sure that if it's done in a spa, that spa has a doctor supervisor. It has to be a medical spa. It has to be listed as a medical spa. It has to be having all the rules and regulations that you would expect, because blood-borne disease can cause trouble. You're dealing with blood, even if it is a patient blood himself, you're dealing with infections. So you want to make sure that you're in a sterile environment, not any little hole in the wall spa that has just a person who trained under a doctor and then now becoming a famous figure, because she's charging a whole lot less, but she's charging less. Why? Because no experience. It's not only the experience, no good material. You have no idea what you're getting. And that is what's happening in the transition of healthcare right now. We need to find the real gold, the real diamond from the fake gold and fake diamond. And it's your job as a consumer to really know the credentials of the person who's going to put any blood product in your body, whether it's your own blood product or somebody else's blood product. You need to have the best of the best of the best, because you deserve that, don't you?
I think so. And what are the dangers of going somewhere where they are not qualified? You know, what things could go wrong if you're not seeing a professional?
What cannot go wrong? That's the question. What can go wrong is, number one, you have no idea that you are where you're harvesting the blood. So suppose you get a person who trained under a doctor like me, and she was working as a manager and observed this, starting an IV on someone who she does not know how to do IV. Bruising, infections, multiple trauma. That's the one thing locally, okay? Imagine you have a port or central line or immune compromise. That infection gets into the entire bloodstream. What happens to you? Is it worth it to save $200 or $500 and get a treatment that would destroy you? Second, what else could go wrong? You are not using a safe place. So you're not even aware of what we call sterile techniques. What would happen if you don't do sterile techniques? You're dealing with blood. A patient, God forbid, has hepatitis C. Or a patient with HIV. Now, you have no hygiene. What would happen? Contract hepatitis C? Now, you have to follow the FDA guidelines. You have to follow the board guidelines. You have to have an FDA-approved facility. You have to have OSHA regulation. Make sure cleanliness. Are you wearing a mask? Are you using sterile gloves? I mean, you're dealing with very sensitive part, you know? Mm-hmm. So that's really the danger now. They're doing a lot of things with all the changes in healthcare right now. There is a lot of people who have no authority that are digging in because they are wanting, it's kind of unfortunately agreed. It's okay if you're trained. I think everybody who's trained and have the proper license and had good results, you need to ask them for results. And you need to ask them for testimony of real people, not fake testimonies. You cannot go on a Facebook page or a website page and you have a fake testimony. That's sad.
And I know a lot of people with this procedure, they're creeped out because, oh, it's blood on my face. That's creepy. Why would you say that's not creepy? That's good for your face.
Number one, it's really, the reason it's not creepy, if it's done the proper way. You are getting your own blood product. You're not getting anybody else's blood product, right? So that's safe from that environment. If you have everything else hygienically done and done properly and harvesting exactly the Buffy code the proper way, having the proper instruments, then you know that you're having your own growth factors in, that they're gonna once injected in the proper way, because they have to be injected in different proper places. You can't just inject haphazardly. So you inject it in the proper places, and then you are now beginning to recruit your own stem cell. You're beginning to recruit your own collagen. So we do that for the internal part of the face, but we also do a vampire facial, not facelift. And that is to really resurface the area with that PRP to also get the growth factors on the superficial part of the face to really start stimulating collagen formation. getting more oxygenation in, getting excess blood flow in. So you really are helping detoxing, rejuvenating, reinvigorating, and just you have a beautiful face. In terms of that, you tell your patients you have to drink lots of water. So if you go to a spa that does not know what they're doing, okay, and they don't tell you, please be sure not to be on any anticoagulation therapy before you come. And you don't even know what anticoagulation therapy is because you don't even ask them what medication they're on. Then they start bleeding. You put that injection in and they bruise and they look horrible for weeks. What if your infection happens for weeks? You need to see the difference between a person that's been done professionally and a person has not been done professionally. The bruising, the downtime, the infection rate. This area is related to the brain. The nose is a direct access to the brain. The infection rate can go very high if you start having infections in that area. So imagine if it's not clean, if it's not safe, if the person bleeds. So you touch it, it bleeds. What would happen? Bruising.
And what is the downtime for your procedure?
The beauty of this, I can even show you some pictures of some of my patients before and after. It's the funny thing, it's less than a day. I mean, just 24 hours, you still go to work, you don't have pain, and then you just, you can put a little makeup if you have a tiny bit of a bruise, but the results are dramatic. The best results happen within 2 to 3 months from the procedure.
And how much would a procedure here in a professional setting be compared to, when it's done by someone who's not qualified?
In average range would be between 1,800, 2,100, maybe sometimes on the low end 1,500, but anything that is 1,200, 1,000 less, you're not getting the proper kits. You don't have the proper stuff. How do you know? If you have never seen how it's done and you trust me, you should believe in what I do. Now, how do you believe me? Credentials? How do you believe me? Results? How do you believe me? True customers that told you the effect, pictures of people before and after, and happy customers and happy results. And training. I am a doctor, but does that mean that every single doctor can operate on you and have surgery done on your appendix? I am trained in this. You have to be trained in this. You have to be certified in it. Anything you do.
All right. I think I'm good as far as questions, unless there's something you feel like I forgot to ask or...
Again, if you work with Akoury, not only because I am an authority and not only because I have worked with a lot of celebrities, Mark Wahlberg and Mel Gibson, more importantly, the beauty is from the inside out. Don't waste your time to come to me if you have no intention to really start at least changing your lifestyle, even if you haven't changed your lifestyle. Because you need to look pretty, because it gives you a desire. It takes your depression away. It makes you feel good to feel lifted and happy. It's really good for you. But it needs to be supported. Well, it's really, really important when you feel good about yourself, your face is lifted. Everything that takes us down to gravity, it really takes us down to where we started. So anytime as we age, we will go down like that. And the babies, they start like that and they erect that way. And the longer you stay that way, the more erect you are, the healthier you're going to be. When your face is down, you're looking down there, gravity is taking over. So when you are lifting your face up, you are lifting a lot of things, and it really works on your neurotransmitters. So lifting it even naturally is the more beautiful thing to do. But in order for this to be sustained and sustainable, you need to eat right. You need to sleep right. You need to learn on the meditative side. You need to drink water. You need to understand what gets you down. But imagine you come to a doctor that looks like that. How would you trust him? When you see me talk the way I talk, would you want to be like me? I'm 64. Yes.
you carry yourself like a young woman.
Yeah. And I tell you what, I am proud to say I'm 64. And I'll say it to everyone, because why would you follow me if I am not the message that I'm bringing to you? I'm the culture. I want every woman, every man, because men do also facelift, and men also do a vampire lift. But we are empowered by who we are. We need to dig deep inside to be powerful. How can I make you powerful? By looking at me. And how are you going to make her powerful? By looking at you. So if you have one person that represents who they are, it really affects a lot of people. So if you start at the root of a person that has hope, a person who wants to really look good until the very end, that's who I want to be. And I want to be an example for everybody around me. I want to be an example for everyone to age beautifully and gracefully and continuously productive and continuously helping and continuously having a mission. I mean, how many 64 years old people have that passion? But all the training I had, all the authority I had, I can say, I'm Dr. Akoury. Really? I am. But that's not, I am me. I'm me who wants to help you, and that's my mission on this planet. And if I have a mission on this planet, my life is good. And every single person on this planet has to have a mission, a true mission, and find their own value. Because your value is what makes you feel good about yourself. You're going to do amazing with your performance at work. You're going to be the best at what you do, anything you do, when you believe you deserve it. But you believe I'm nothing, I'm the bottom, I'm this, I'm that, you're going to act the same way. But a person with integrity is always going to do things with integrity. How does that come? From seeing example in coaches, from seeing people who've been there. And I want to teach everyone that wellness begins from the inside. Wellness begins, food is medicine. Wellness begins when love is medicine. Wellness begins when every hug is a medicine. So to me, yes, I need the facelift. I do, and I actually had it. I did my own sometimes. But really, Dr. Reynolds, when I trained with Dr. Reynolds for Vampire Lift, he done my face. I have my face before and after. But honestly, my after, for a long time, I really looked very bad. And I got better. But my patients don't. And I have my picture after the vampire facelift done by the expert, which he's an amazing guy. And I'm grateful that I've known him. And my results, before and after, was no makeup for people that I've done. Why? Because I do it with passion. I look at the beauty of everybody's face. And I try to make it less bruised than ever. And just give you the empowerment from the inside out.
Perfect. That was so good. That was inspiring.